Escape Pain is a rehabilitation program aiming for people who have osteoarthritis in knees and hips. It's a free program. It runs for 6 weeks. It's 12 sessions in total, and it runs twice a week for an hour, and it is a combination of exercise and education. That basically encourages and teaches participants to take a control of managing their condition. So it's a unique combination of raising awareness and teaching people a little bit more about condition itself and teaching them how to manage that better.
Escape Pain has been hugely important for Newcastle and Gateshead. We approximately receive over 600 referrals over a 6-month period for this group of people. It allows us to see people in groups and provide them with appropriate progressive exercises and gives them valuable education on how to self-manage their condition moving forward. It also reduces the number of referrals into secondary care, and hopefully in the future will reduce the number of joint replacements that are needed. Even if someone does go on to have a joint replacement, we know that exercise before having an operation will help in their recovery and their outcomes will be a lot better. People living with joint pain of 3 months or more duration can lead them into a very vicious circle of pain. So naturally people become more sedentary because they have pain in the joint. They reduce their general fitness, they gain weight, they become more stressed and anxious because they're in pain, and then leads to social isolation. So if we can break that circle and get people more active and teach them how to manage their pain, it has a huge effect on this group of people. TIMS have invested in their team to be trained to deliver Escape Pain. We've also worked in partnership with Healthworks and the Older People's Assembly in Gateshead to allow us to deliver Escape Pain across the community of Newcastle and Gateshead so that we can reach people across the whole community.
They are delivered in clinical environment and in a community environment as well. For community environment, we are hoping to take people away from clinical and health settings. So hopefully they disassociate exercises with a clinical environment. At the same time, it's important to keep clinical options as well. They are within ease access, so they are all within regular bus services and they're easily accessible. So it's good to have a variety of options really.
During COVID, obviously we were unable to offer face-to-face sessions. So what we have done is set up virtual classes over Teams and offer exactly the same program of exercise and education. We actually had one virtual group that got on so well on the screen and they loved the sessions. They went off and created their own Zoom group to carry on. The face-to-face sessions we've also adapted in accordance with government guidelines. So obviously we've reduced the numbers in the group and we ensure that we do social distancing. And we've changed the format slightly so we're not moving around the space but that you are very much in one position. Over the last 12 months we've delivered 13 groups of Escape Pain with an estimated saving of nearly £100,000 to the health and social care sector. So obviously in today's climate that's hugely important to the NHS.
I'm out today, I'm out tomorrow and I'm out on Saturday. Now a couple of months back that would have been unheard of. And it's just through coming here. I'm going to see River Dance on Saturday.